Welcome to TMI with Teryl and Martha. And this week, we're going to be talking about hormone replacement therapy and all things related to that. Teryl, who do we have?
Well, we have the world famous Dr. Mickey. And I say that because she is actually treating me and she's helping me along my journey to health. And we met recently and become fast friends. So Dr. Jaimie Mickey has recently set up office here in Gainesville, Georgia. She's been here for about a year, working 1 week out of every month in this Gainesville, Georgia area. She's my functional medicine doctor, but I'm going to let her tell you a little bit about herself. So I want to happily introduce Dr. Jaimie Mickey because she is an angel incarnate. So,
well, thank you for having me.
Thanks for being
I'm
here.
excited about being here and to be able to share about hormones, bioidentical hormones. As Teryl mentioned, I have a practice actually in Florida, but I've expanded this practice into Georgia. So I'm only here part-time, but my main practice is down in the Tampa Bay area of Florida. And I guess I should tell you a little bit about my background.
Yeah.
I'm originally family medicine trained, but also have dual board certification in integrative holistic medicine. And I'm a fellow of the Academy of Anti-Aging Medicine, where I've done most of my functional medicine and, of course, hormone training. Today, we're going to talk about hormones, specifically bioidentical hormones. And really eager to share with you about that because that is actually part of, the main reason why I even switched to a functional medicine from a family medicine career. I had, as a practicing family medicine doctor, I had quite a few women coming to me once a year for their annuals. I would only see them once a year because they were so healthy. They weren't taking multiple medications. They weren't seeing multiple specialists. They had good energy, good moods.
Like me.
Yes. That, they often looked 10 or, 15 plus years younger than their counterparts. And I the one thing they had in common is they're all on these bioidentical hormones. And I'm like, what are these bioidentical hormones? I need to learn more about these. This is something I did not learn about in medical school as an allopath. We don't really get a lot of that training other than, maybe that hormones could potentially be dangerous. And so I kind of had that view. So I kind of started on a little path to learn more about bioidenticals to understand why my healthiest patients were all on them. And once I learned about them, there's no going back. I had to be able to prescribe them. And that switched my whole career. And now for the last 8 years, I've, expanded, of course, well beyond just offering bioidentical hormone replacement in my functional medicine practice. But that is definitely one of those foundational things that we do.
So there are so many feelings that come about when people talk about hormone replacement. And so the first question is always, because we have had mixed messages, you pointed that out, is hormone replacement safe?
Yeah, that's always a question I get. If somebody's not real familiar with hormones or unsure, that's the first thing they're going to ask because, there were these really large studies about 25 years ago now in the early 2000s called the Women's Health Initiative studies that actually had all the women scared off their hormones, all the doctors scared of prescribing hormones because they were showing some really significant increased risks of things like heart attacks, strokes, increased risk of breast cancers. So of course, that's going to be a big concern. But what they didn't tell you about these studies is the hormones that they were studying that were showing the higher risks were actually synthetic hormones that were being, made by the pharmaceutical companies to mimic our own hormones. And so I call those synthetic one-size-fits-all hormone replacement therapy. And those definitely do increase inflammation and do have some increased risks involved. What they didn't tell you is that the other half of the women in those huge studies that these pharmaceutical synthetic hormones were being compared to were on bioidentical hormones, totally different ball game. And in those women, there was actually significantly less risk of heart attacks, strokes, and breast cancers. And so smart people realized this once they shut the studies down prematurely. And in the last 25 years, hundreds of more studies have been done specifically on the bioidentical hormones that continue to prove that these are actually very safe and actually very protective of our health. There's no coincidence that chronic illness and disease accelerates after menopause in women. We know heart attack and stroke risks increase equally or maybe even exceed a man's risk after menopause. And again, it's no coincidence that it's because they've lost some of their protective hormones.
Wow.
Yeah.
So are they still producing these synthetic hormones, and do doctors still prescribe synthetic hormones on that basis, just
Yeah.
out of curiosity? And that's
Unfortunately, yes. I think there's a lot of doctors that just don't even realize that the potential dangers, or they realize the dangers. And so then they tell their patients that they, should be on these for as little of time as possible to reduce these risks. What they don't realize is they have a whole nother option of safe and, bioidentical hormones that they could be prescribing. But you really need a lot of training in hormones, bioidentical hormones to do it correctly. And again, most doctors just don't have that additional training. And so it's easier just to pick a one size fits all pill that they can prescribe through the regular pharmacy, through the insurance, and then just, hope for the best, but those types of hormones are not allowed in our practice. Those are 4-letter words in our practice. We don't use synthetic hormones. But unfortunately they are still available.
So what are the benefits of bioidentical hormones?
Oh my gosh, with a list. How much time do we have here now?
Yeah.
Oh my gosh.
We can do another episode too.
a-
There's no telling.
And then we might need to. So, a lot of women come to me, and I have actually male patients. There's something called andropause. We'll have to have another topic on that. But there's menopause, which is, what women go through, and then andropause can happen in men too. But anyway, so what most women seek any hormone replacement period is because they are having symptoms of concern, right? Hot flashes, night sweats, brain fog, muscle aches, insomnia, anxiety, all of these things that they had very little of, if any, prior to the loss of their hormones. And so, when we can give back bioidentical hormones, which, by the way, are plant-based, again, they're called bioidentical because they actually do look biochemically just like our own hormones that we once made. So they're welcomed by our bodies with open arms, like an old friend, and don't increase, again, the inflammation levels that can lead to all of those risks that we talked about earlier. But back to, what are the benefits? Well, that's icing on the cake: improving sleep, reducing anxiety, getting rid of hot flashes, improving libido, sexual function. Those are all benefits. But there's also improving bone density, decreasing dementia risk, decreasing cardiovascular risk, heart attack risk. So I call it anti-aging, like the ultimate anti-aging preventive medicine. It's truly slowing down the clock, turning our bodies physiologically back to where we were in our 30s is the goal.
It is so interesting because in several of the ones that we've done so far, the people we've talked to so far, that term inflammation comes up.
Yeah.
And you just brought it up, and it seems to me that that's a theme running through all of this, is that a lot of us have unresolved inflammation, or inflammation from things like my mother had arthritis, my grandmother had arthritis, I have arthritis. And so that seems to be a theme that runs through all of these.
Oh my gosh, yes. Inflammation's just basically the foundation of every chronic illness or degenerative disease. And that's a whole another topic. We can talk about kind of the foundations of functional medicine. And functional medicine being root cause medicine, and bioidentical hormone replacement definitely resolves symptoms and definitely, can help with some of these chronic conditions, but we still need to understand where there are sources of inflammation coming from. And bioidenticals do not contribute to that inflammation. Synthetic hormones do. But again, that they're, so that's why, we should avoid the synthetics whenever possible. But inflammation is truly, the root cause, but that's a whole nother podcast. Yeah.
I would love to know, just personally, how much education did you receive? Most of us are experiencing, women with menopause. I cannot tell you how many people I have spoken with that are so fed up and so flabbergasted would be a good word with their menopausal symptoms and their inability to weed through it all, right? To figure out what direction to go. How much training did you personally receive in your medical degree relative to hormones and to women's health as it relates to menopause, even?
Yeah, none. We don't get really any um, effective hormone training. In my opinion, I had to again go through significant additional training to really feel comfortable at assessing hormones and properly replacing or restoring or balancing hormones outside of my conventional medical degree. And so it's definitely uh, not a priority or focus in the current curriculum.
Wow, that's
So
good to
is
know.
that true just for family medicine? I don't expect you to be an expert on medical
Yeah.
education, but is it different if you're in the specialty of OBGYN? Would they get more training there?
I wish they did,
Okay.
but no,
Yeah.
and not even the endocrinologists. I mean, they're hormone specialists, and yet they get very little training on this form of hormone replacement. But there are a lot of progressive gynecologists that have had additional hormone training, just like myself, in bioidenticals that do a great job.
Yes.
But you got to find them because not
Yes.
most of them do.
Well, that was
Or-
my understanding from I have a lot of friends just like you do in the medical arena. And that's basically what they told me was that, gosh, we just didn't have the information. We weren't given that information.
Well, and I think on top of this, the challenge you alluded to is that probably this treatment is not covered by most insurance.
Right.
And so you're limiting the pool of people that can afford to do this. And I know that's a challenge because, there ought to be studies on this stuff. And it does
Yes.
seem like many times that the big problem that you have is that studies about women, I mean, we're just starting to catch up with studies about women and how they did almost all the studies up until the 1980s were all done on men, and they haven't done that much improvement since then. So that's a big issue. And certainly how you pay for it is a big issue too. And I'm sure that's something you have to discuss with every patient.
Yeah, you're right. Because, well, again, a lot of doctors that prescribe bioidentical hormones themselves don't take insurance, and that includes our practice. We did for the first 4 years, but the last 3 or 4 years, we had to move away from that model, just to be able to provide better quality of care. Um, and then the bioidentical hormones themselves, yeah, the compounding companies, because again, these are custom dosed, custom made to the individual based on the testing, that we do, so that they, can, be as beneficial. We don't want to overdose or underdose even the very beneficial bioidenticals. So, but yeah, there is some out of pocket cost. The theory is, but I do take care of a quite a wide variety of patients from demographics, and you just kind of choose what you can afford and what you want to prioritize.
Right.
Because we pay now or we pay later, and so if we invest in ourselves and our health now, then again we're going to be doing a lot less cleanup, catch up work down the road once our health has maybe declined to a certain
Absolutely.
point.
So if you go on hormones, how long would you stay on hormones?
That's also a good question. That's a question I get frequently. Forever. You only get the benefits while you're on them.
Right.
It's not like we can replace them for a little while and then they're going to last forever. Your body's no longer making these, especially the estrogen and the progesterone. Those, once your ovaries retire, that's the official,
Retire.
they go on retirement at that menopausal transition. You're not going to have those protective hormones. You're going to make one type of estrogen that comes from the adrenals and from fatty tissue, estrone, but that's actually a little bit more of an inflammatory estrogen. So every postmenopausal woman has a predominance of estrone, which again is inflammatory estrogen. And so what we give you when we're doing bioidenticals is we give you back what your ovaries, the protective anti-inflammatory estrogens, we give you the estradiol and the estriol back. So to balance out that now predominantly, that predominantly, or I guess, an estrone dominant state. And
Well, I personally love retirement, okay, because I feel better than I did 25 years ago. I'm in better health than I was 25 years ago. Sex life is better than it was 25 years ago because you always worry about that sort of thing
Yeah.
afterwards.
Yeah.
But, maybe that's because the kids aren't home. I don't know. That could be what it is.
No, you're
That's
actually,
true.
I mean, you're actually making some really good points. Like, why are some women miserable and have a horrible time after they
Right.
transition into menopause? And why do some women have no problems at all and actually feel better than ever?
Genetics.
Well, there's
I
always
think
that
that's
genetic
true,
component.
for sure.
But you know what it boils down to? It boils down generally to the adrenal glands. How strong are your adrenals?
Wow.
Because once the ovaries retire, the adrenals have to take on the brunt of the work. And if you have weak adrenals or worn out adrenals because of chronic stress, and stress doesn't just have to be external stressors. It can be a lot of internal stressors, internal fires, metabolic, inflammation, infections, toxins, all these things that stress our body.
Mycotoxins.
So so the weaker the more adrenal dysfunction there is, the more menopausal dysfunction there.
So that leads me to another question. I'm a type A personality. I'm very hard driven, and all my life I've been a person that handles stress really well. But now I'm at a place in my life where I think, was that really the best for me? Do you know what I mean? That I've been in high stress businesses all of my life. And, all in all, I feel great, and all of that. But you wonder about that, don't you? That I know we tell ourselves these things like, oh, I can handle stress.
And we
it's
adapt.
like, yeah,
We
absolutely.
adapt.
So
Yeah.
what's your thought about stress and managing stress?
Oh my gosh. Well, I think we all have a different capacity
Yes.
for that. It's just, and again, some of that might be also, genetically predisposed. Some of that has to do with how much support we get from, our loved ones and those are our closest to us. And so there's just so many different factors that go into, how we ride the wild waves of stress that life
The
can.
wild waves
That's
of
right.
stress.
So, and then
I love
before we
that.
go back to Teryl asking a question, it leads me to the next one. This is
Right.
very exciting. Can a woman of any age
This really is.
benefit from hormone replacement therapy? Because, like we talked before we started the podcast, I'm past menopause.
Retirement.
Yeah, and I don't mind the M word. I mean, honestly, it's a natural function. I mean, what's the alternative? You're dead and you don't go through menopause. So I'm okay that I went through menopause. But I've been the other side of that for about 17 years. And so what are your thoughts on that about the ages?
Yeah, I am, you're always going to get the most benefit the closer you are to the menopausal transition. So if we never let your hormones drop off to begin with, then, obviously the anti-aging benefits are going to be superior. But I have women in their 60s or 70s. In fact, my oldest patient on bioidentical hormones is 93 years old.
Wow.
And of course, she's been on them way longer, probably longer than I've been a doctor. But she is still running her own business at 93 years old.
Oh,
so
my
if that doesn't
goodness.
speak for the cognitive protection and, the physical, both, the mental and physical protection that bioidentical hormones provide, I don't know what does. So
That's
she's
amazing.
very high functioning 93-year-old.
Wow.
So, but yeah, I have, obviously the most benefits going to be when you're transitioning in your late 40s, early 50s. But I certainly have plenty of women that we start in their 60s and 70s, and they can still get plenty of benefit.
Well, that's, kind of leads me back to one of our conversations where it was like when you go and you ask someone, how you feeling? And they're going, great, I feel wonderful. How are you? And they don't go further than that. How do you really feel? Do you really know? Because that's the thing is that there are tests now. Why not find out where you really are and see? I've kind of adapted. I'm running around and Dr. Mickey looks at me and she said, this doesn't match this.
Yeah.
Right? Because my lab said something completely different relative to my health. But as far as I'm concerned, you and I are same animal. We're type A driven. I can overcome anything, any challenge. I feel great all the time. I wake up and I make myself feel great, even when I don't feel great. Right? So it wasn't until I got really kind of to the point where I knew something was wrong. That might have been way too long. right? Before I actually acted on this. So, we first kind of have to look at this process and say, even if you feel great, how could it hurt necessarily to check your levels and just see where you are and make an informed decision rather than just deciding and then finding out later that maybe you had a problem and you just overrode it because you're a strong mental woman or man who can override their own sense of debilitation, I guess I'd call it.
Mind over matter.
Mind over matter. I'm great with mind over matter.
I think we all are.
I know. So I think it's important to note that there's no one too old to begin this to look at this process, because at any given point, you may get a chance to turn it around, in some way, shape, or form, which is very interesting to me. That's an open possibility. It's not too late.
Well, and so many women are waiting to have children now. They're not having their children until they're in their late 30s or 40s. And my niece, what a blessing. They didn't think they were going to be able to have children. And then at 39, she found herself pregnant. They used to say in the old days she fell pregnant. I think that's hysterical. But she's very happy about it. But she's certainly in a different place today than she would have been if she'd gotten pregnant at 20 or 22 or 25. So what is the time when you should start thinking about this? And is that impacting the fact that women are waiting later to have children? Does that impact when you go through menopause, or is that kind of preset?
Yeah, I have not personally seen that. I think that typical, usually women will actually start noticing some perimenopausal, that's the term we call that. Where we start transitioning, and that can, for some women, be a decade. For some women, it can be a year. It varies from person to person. But I think every woman will start seeing some changes in their 40s, some even as early as their late 30s. But most women, it'll be probably mid 40s, and then certainly very evident changes by their later 40s, and usually by early 50s. Most women have transitioned, and the definition of menopause, if we're, just foundationally, is 1 year of no menstrual cycle. You're officially menopausal at that point. But
that makes sense.
Yeah, I'm not aware of any, connection between if a woman gets pregnant. I mean, clearly that's wonderful if a woman can get pregnant naturally in her late 30s or early 40s without any assistance. That's, speaks volumes. I'm not sure if that means that she would be going through a later menopause. It's a good question. I don't know the answer.
It's funny, on my mother's side of the family, there was a lot of female problems, is what they used to call them,
Yes.
And I had one aunt that had a full hysterectomy at 19. She had
Wow.
problems, very serious problems.
Very early.
And then my mother was 43, which is a little young. I have this theory, and you can tell me if I'm crazy, but that so many of us of our generation, for good or for ill, were on birth control pills that were hormones. You were taking hormones. I think it masked some of those problems in this generation of women in my family. And then they showed up later when we got past childbearing age. Yeah. So I have nothing to back that up other than just kind of be observant about things. But that's something a lot of women in our age group, we were kind of monkeying with our hormones because we were taking birth control that was hormone based.
Well, and I'm glad you brought that up. It's a little off topic, but I think it's an important topic because so many women are taking birth control pills and waiting, like you said, till, getting their careers established, getting lives established a little bit more before starting families. And oftentimes this can, take women well into their 30s. But, there are some statistics on, the longer you're on a birth control pill, the higher the infertility rates are, so we definitely know.
Important because you've had a personal situation where you understand this very specifically. So it's not like theory. It's real.
Yeah. So definitely, I don't even know how many doctors. I certainly, when I was practicing conventional medicine and prescribing birth control routinely, and also taking birth control, I had no idea. I didn't even know to be able to give my patients that informed consent that, studies have shown that being on the birth control pill for more than 10 years can decrease fertility rates by like 50%. And if you're going on 20 years, it can be up to an 80 to 90% increased risk for infertility. So just definitely make sure for the younger ladies listening or watching today that, you're aware of that. So when you're choosing your family planning methods, the long-term birth control pill might not be the best option.
Yeah, I think that's so interesting. What do you see as the number one question that people ask you? Because there's got to be, there's got to be a whole list of questions that people have when they come in to see you the first time. But what's the number one question?
Gosh, we've already hit on most of them. That the first one is this going to give me cancer? What are my risks? Because every woman thinks hormones and thinks cancer. I mean, it just seems to be ingrained. And again, so we kind of explained that. And the other thing is, am I too old? What kind of, now that, I'm, this, what, and then because of my age, are there any other risks involved? So those would probably be the top questions I get.
Those
and
are
then
good
how long do I need to be on them? So you guys already hit them.
Yeah.
Yeah.
Forever, right?
Pretty much. I mean, you're only going to get the
It's a
benefit while you're
forever
on them.
benefit. Yeah,
I'll
it's a
be that
forever.
93-year-old lady.
Yeah. Well, again, she's my poster child. I tell her every time. So but she, there was something I kind of thought about after you mentioned how, you feel so good, at this point in your life. And that kind of made me think, well, I bet you if I did saliva testing, and so that kind of takes us into like what kind of testing. And that's why you really need to have a doctor who's very familiar and has a lot of training in hormones, because there's a lot of different ways to look at hormones and different reasons for the different testing. And I always like to start with a saliva test for a couple different reasons, because over blood test. I also get baseline blood tests, but saliva tells us actually what the hormone levels are in the tissue and at the cellular level, where blood tests just tell us what's circulating. So it's really it's not going to be as accurate as a saliva test. And something I have.
Interesting.
She did both with me.
Yeah.
So
I like
had
to start
both.
with both, because then I monitor blood once we start hormones. But I mostly monitor my patient. How are you feeling? That's the most important thing at the end of the day, rather than what the paper says. But, but my experience has been, I have had a handful of women in their 60s and even up into their 70s when we start with a saliva test, and maybe they don't have a ton of symptoms. Maybe they just want to help slow down or reverse like their osteopenia. That's, borderline osteoporosis. So they're looking at it for more of a preventive medicine reason. And then we check some hormone levels, and actually they're at the tissue level. They don't actually look too bad. And so every now and then I'll see that and I'll be surprised, like, wow, that's a kind of a decent level of estrogen. It's uncommon for somebody at this point in your life to be making that, but clearly your body is. So that's why I think it's important to do really proper testing, because you don't want to give somebody something that they're not going to benefit from,
That they
or
don't
don't
need.
And you
That's
certainly
right,
don't
right,
want
of
to
course not.
overdose. Even the bioidenticals, too much estrogen or too much testosterone, too much of anything is no longer maybe a good thing. So we really want to do it well. We want it to be custom to the patient, and we want everything to be well balanced.
So while this is not a hormone question, and I know you've got a couple of more, what's your thought process on vitamin supplements? Because there's a lot of discussion about that, about whether it's better to get it from your food or it's better to get it from supplements.
Well, again, so that takes me, two foundations of functional medicine are, supporting hormones, whether it's replacing or balancing, and supporting optimal nutrient levels. And I don't
Optimal.
I truly don't think that even the people with the best of intentions and the best of diets can truly get optimal nutrient levels through their diet. And then that's, a small percentage of the patients that are actually eating optimally, right? The majority of the population is not, but our foods are depleted, our soils are depleted, and so therefore we're depleted. So I really think it's almost nearly impossible to get optimized. And then we have all the digestive. That's another, all the digestive issues that lead to so much inflammation, a big source of inflammation. And if we can't properly digest and absorb those nutrients, even in the supplement form, we're not going to benefit. So another foundation of functional medicine is fix the gut first, so that you can actually benefit from your food and from supplements. But I do think there are like a foundation, like 5 foundational nutrients that we really need high levels of to support healthy, immune systems, healthy energy production, healthy detoxification, healthy brain function, so yeah.
What are those 5 things?
Spill it.
I'm on the edge.
Everybody, B vitamins. Let's start with the B vitamins, especially because that's a good in the context of hormones. B vitamins are frequently depleted when I see patients before they've even started their hormone replacement. You go to Europe. I was actually in Europe and working with some Swiss biological medicine doctors. It's kind of the equivalent of functional medicine in the US, a little different. But anyway, their cutoff for B vitamins, B12 in particular, is like 800 or 900. Our reference ranges let us go to 200. I used to say I didn't want my patients under 500. Now I say 800 or 900 because that's what the Swiss docs say. And when you're on hormones, you actually utilize more B vitamins, so you can actually become deficient. So anybody on bioidentical hormones has to be on B vitamins. Even if they start out normal to begin with, we don't want them to become deficient. D, vitamin D as in dog, that's another big one. And remember, it's not a vitamin, it's a hormone, and this is a hormone talk. And so it is so important to maintain a proper vitamin D for your immune system, for your heart, for your bones, for your blood sugar. It impacts glucose, insulin. There's just so many roles. So we don't want a low range. We want an optimal vitamin D. Omega-3s, fatty acids, very important, very, not just for the heart, but for the joints, for the skin, for the eyes, for the brain. We need optimal omega-3s, and most of us don't eat enough fatty fish.
I hope you guys are taking notes because this is so important. It is very important. So please, please, please take notes on all the information she's talking about. We'll have her back for sure.
Yeah.
But yeah,
that was
Continue.
3. So those are
3. So there's 2
3.
more.
So I also like to support antioxidants. So, various antioxidants, especially in anti-aging. I think CoQ10 is something that we often get depleted of. And magnesium. Oh my gosh, magnesium. I should have, so most of us, so anytime we're stressed, we're going to deplete our magnesium, we're going to deplete our B vitamins, we're going to deplete our CoQ10. So that rounds off 5. But
Yes.
magnesium helps us sleep, helps us have better bowel movements, helps us feel more relaxed. There's so many, I call it the miracle mineral for a reason. Could have a whole podcast just on magnesium.
That's so great.
I've been taking magnesium for years, and I've just been blessed to be involved in a business that I have easy access to all these products. And I've already found out important questions like, do I methylate B vitamins or do I not? That's a whole different podcast. Do you methylate or do you not? We have, I think, proof that there's about 50% of this population that have what they call the MTHFR gene, or at least 1 or 2 SNPs of that. And
what's methylate? A lot of people won't know that.
Right. So
it's a biochemical process by which our bodies make energy, and B vitamins and minerals, magnesium being one of them, are the key, players there. In order to make energy and detoxify, 2 really important processes that every single one of our trillions of cells needs to do. About 50% of the population has a methylation SNP or, an MTHFR SNP that can compromise that. So again, back to the B vitamins. So being on methylated or what we call activated B vitamins, because in those that don't methylate, they're not able to activate their B vitamins to where their body can actually use them. So again, it's also important you're working with somebody who understands this, so that you're not wasting your money taking maybe vitamins that aren't actually serving you or that your body can't utilize.
Even with IV therapy, you've got to ask if they're methylated, because I just talked to a gentleman doing IV therapy, and he was like, wow, that's a great question. Let me check. And that's a whole separate line of IV B vitamins, which is a very hot topic right now, B vitamins. And so you've got to get them methylated if you're, if you have
that. Yeah. And they're not necessarily for people that don't have methylation gene variants. The methylated B vitamins aren't necessarily, they're going to be just as effective for those that don't. They're going to be more expensive. But on the flip side, for somebody that does have a methylation deficiency, if they're taking a non-methylated B vitamin, especially folic acid, a non-methylated form of folate, they actually can be potentially, not just not usable, but potentially like dangerous or toxic to those people. And remember, a lot of our foods, processed foods especially, tend to be fortified with folic acid. So that, you know, again, so knowing your methylation status is important. Yes.
So it's got to be exciting because that we are starting to have these discussions about foods and about all this kind of stuff that's in our food. And I think it's
Exactly.
great. So if people want to get more information about what you do, or if they wanted to schedule an appointment with you, how would they do that?
Oh gosh. Well, I can give my phone number.
Yes,
And
sure.
I have a Georgia phone number, but off the top of my head, I'm not even sure what it is, but I know what my Florida phone number is. So let me, um, give you that. It's area code 727-351-1700. And then email is also a great way. My staff is fantastic at, email responses. And that would be you would go to hello@restoringwellnessmd as in medical doctor.com.
That is so exciting. We've got a lot to talk about.
I think
Yeah.
we could do multiple shows with
Yes.
Dr.
Oh,
Mickey.
yeah. This is just the
Because there's
beginning.
so
This is
many.
just a sliver of what functional medicine has to offer.
Right. And just, just before we end, let's just talk real quick about 2 different methodologies that they can start looking into as to how you're going to replace those hormones.
Oh,
Just real brief,
Mhm.
so that we can just give them some heads up as to what to ask for or what to look for, if that would be okay.
Yeah, so I prefer, and the way I've been trained, I think, especially when you're brand new to hormones, I'm always going to always err on the side of more conservative. And so I always like to start my patients on creams, specifically for estrogen and testosterone. Progesterone can be done in a topical cream form or oral. I do tend to do oral progesterone because that tends to hit the GABA receptors to help with that brain, the insomnia that can kind of be a problem for a lot of women after menopause when they lose their progesterone, because progesterone works on the sleep receptors, the GABA receptors, the same receptors that a lot of sleep aid medicines work on. You can simply give yourself back the hormone that once worked there, progesterone. So love progesterone at bedtime. Generally at the oral form. There's some women that can't tolerate, for various reasons, the oral form. Small percentage will switch them to topical creams. But estrogen and testosterone definitely like to start out in the cream form. And then, again, depending on what your initial saliva says, that kind of gives me a ballpark starting dose. Then depending on how you feel, we can make some adjustments. Usually the first year, it takes about every 3 months, we make some adjustments. Some women, we hit it out of the park the very first time and get them on the right doses right out the door. But other women, it might take a few tweaks. But usually by the end of the year, we have you feeling really good. And then that, goes into, another form of testing we didn't talk about is urine testing. How do you break your hormones down? And that's what we like to do, 6, 9, maybe 12 months into hormone replacement, because there will be a small percent of women that will even take their healthy, safe estrogens, bioidenticals we're giving them, but their body's going to convert it maybe down an unsafe pathway. And we don't know that until we check a urine specimen. So we check urine metabolites on all women within the first year on hormone replacement. And those women, that the 10% or so that don't metabolize properly, they don't have to stop their hormones. They just need a little more support to get them metabolizing their estrogen properly and safely. And then there are pellet form. You'll probably hear a lot about hormone pellets. It's a small percentage of my practice that we do pellets. And those are usually women that they're on the upper ends of the testosterone, the normal topical testosterone range, and they're maybe just not seeing the benefits that they would like to. And so those are the women I usually graduate and say, hey, well, why don't we try a pellet? And then so pellets go under the skin. There's bioidentical. They're placed every 3 months. Some women can get away with a little longer. And it's definitely convenient, but it's a bit more invasive. And so I never start women out on pellets. I want to know all about how they do on the low dose creams and tweak their doses and make sure I know how they're metabolizing their hormones properly before we just put some pellets in that can't be taken out for a few months. But I do have a small percentage that really love their pellets. And so we graduate them to pellets. But so that's my approach.
I think less is more when it comes to messing, really any kind of a manipulation of hormones of that nature.
Well, I think anything. I mean, you should start out, even traditional medicine, you should start out with a lower
Always.
dose
And
before you move up.
Yep.
I think that's
Common
good.
sense.
Good, good practice.
Yeah.
It's called the practice of medicine for a reason,
It is.
right?
It is. Yeah. So,
Well, it was great having you here
Thank
today,
you.
Dr.
It was
Jaimie
great being here.
Mickey. We want a lot more information. We want you to like and subscribe to TMI with Teryl and Martha. We'll put all the information in the notes as far as how to contact Dr. Mickey, and we look forward to getting back with you again next week.
And as always, we absolutely appreciate that you are watching TMI with Teryl and Martha. And we do want you to share with your friends all this incredible information that we have to offer. And we absolutely love doing what we're doing, and we hope to continue doing it for quite some time because your wellness deserves a little oversharing.